Hi everyone, welcome back to iMumz Ask Me Anything session. And today we have another topic and a very special gynecologist with us. So I'll quickly introduce her to you. Ma'am has been in the practice for more than 30 years, taking care of women, hand holding them, and making sure they are taken care of during pregnancy. And Dr. Meenakshi Ahuja, she's the director of Obstetrics and Gynaecology at Fortis La Femme. She has special interest in infertility, endoscopy, and menopause. And she is also trained in cosmetic gynecology. So yeah, she has a huge experience and a lot of talent inside her, and I hope you can make the most out of it. She's been involved in so many community sessions and creating awareness and all that. So welcome to the session, ma'am, and over to you. Please tell them about the importance of prenatal vitamins.
Yeah. Thank you so much, iMumz, for having me here. So, thank you for the lovely introduction. Although I think I must, express that my passion may be a lot of other things like cosmetic gynecology, menopause, adolescent health, but my love is definitely obstetrics or the care of women in their pregnancy. And starting on that note, today I've been asked to speak on the importance of prenatal vitamins. What are prenatal vitamins? Prenatal vitamins are vitamins and supplements that we start. We use it in a broad term for just not vitamins, but also for supplements that we start when we are planning a pregnancy and to continue during pregnancy. We also continue them after delivery because definitely there are certain supplements which go in the breast milk to the mother and baby, breast milk to the baby from the mother. And that is why the importance that we continue having those supplements from the time you are planning a pregnancy till the time you are breastfeeding, at least, if not more. So, why do we start prenatal vitamins? So, when a woman comes to me saying, see, all of us are now planning pregnancies, girls may be married for 2 years or 3 years, and then suddenly they want to plan a pregnancy and they come to the doctor saying that, look, now I'm ready. And what is it that I have to do? I think it's a brilliant idea to go to your doctor for a preconception counseling, because now that the pregnancies are planned and they're not happening when you're 18 or 20 or 22, but probably at a later date because more and more women are working and they want to prioritize their pregnancy at a particular time, it is a good idea to come to your doctor for a prenatal counseling. And what happens then is that because you want that your pregnancy should be perfect, right? It's not that, these are fussy things that we are doing now. Earlier, people used to have lot of pregnancies, lot of mishaps, lot of miscarriages. Now, when a woman plans a pregnancy, she'll plan it once, twice, or maximum thrice in her life, and she will want it for keeps, want a healthy baby, and ideally the best that she can have. And that's why we always say कि अगर बीज अच्छा होगा तो फसल तो अच्छी होगी ही. And that is why the importance of starting these vitamins even before you're planning a pregnancy. These vitamins, the prenatals, are not only folic acid, which is actually the most important, but other things also, which I will be talking about. So, what is folic acid? Folic acid is a part of a vitamin B. And why is it important? It is important because folic acid is a water soluble vitamin. It's not stored in the body. So, you can't take folic acid for 2 years and say that now I'm not going to take it because I have enough in my body. When you are planning a pregnancy, your egg needs that folic acid so that there are less chances of having abnormalities in the brain or the neural tube or the spinal cord of the pregnancy. It has been seen that folic acid is a food supplement and you have to take a 5 mg tablet every day when you're planning a pregnancy. The only problem is that if you think that, okay, let me get folic acid or folate from my food, it means that you need to eat 15 kilos of oranges every day, or, 17 kilos of apples every day to be able to get that much amount of folic acid in your diet. So actually, with kilos of broccoli or apples or oranges, it's not even possible or practical to think that I will get these nutrients from my diet. And that is why it's very important. And it has been seen the easiest and simplest and the best way of decreasing congenital abnormalities in the newborn and during your pregnancy by having folic acid. And that's why folic acid becomes extremely important. Nowadays, there is also an activated form of folic acid because some people have hyperhomocystinemia. And that is why women are recommended that they should take an activated folic form of folic acid so that the chances of miscarriages and mishaps are even less, and they end up having a happy and a healthy pregnancy. So that was number one. That's the folic acid, which you must start as soon as you are planning a pregnancy and continue it during pregnancy throughout, right? Also, when you're planning a pregnancy, I like to check your vitamin D and start vitamin D supplements. A vitamin B12, because B12 is important for your iron to convert into hemoglobin also. And that is why the B12 supplements also need to be taken. We must remember that most women in India are vegetarian, and that is why they end up having a B12 deficiency. And that is why it's a good idea to take some B12 in your diet in the form of a supplement, especially if you are vegetarian. Hemoglobin, if it is low, you must take iron supplements. So if anyone comes to me to when they are planning their pregnancy to talk about prenatal vitamins, I would like to check their hemoglobin, start some iron supplements, start folic acid, of course, give them B12 if they're vegetarian or their B12 levels are low. Give them some calcium. Calcium is extremely important, especially if you're on thyroid medication or you're a hypothyroid, because your bones tend to be weaker. And you know very well that in pregnancy, the calcium is going to be leached out of your bones. So start calcium and vitamin D also. Once someone gets pregnant, at that time, I usually stop the other supplements which were going on, except probably the B12 if the vitamin B12 was low, because like I said, B12 is a water soluble vitamin also. And continue with the folic acid in the first 3 months. After 3 months, with the prenatals, I would start iron and calcium as well as vitamin D, which will continue. Also, in the second trimester, we like to give you a lot of DHA. DHA is docosahexaenoic acid or omega 3, which is important for the baby's brain development, intelligence, the retina or the eyes, and the nerves. So, for the eye development, brain development, and nerve development, we like to give you DHA. DHA is found even in natural food sources like walnuts. And you must start that in the second trimester and continue that along with the iron and calcium and vitamin D, even when you are breastfeeding, so that the DHA goes in the breast milk for the baby's brain development, because actually 80% of the baby's brain development occurs when the baby is in utero and in the first 2 years of life. So that was about the prenatal vitamins, and I think I'm ready to take all your questions right now.
Thank you so much, ma'am, for that brief but very elaborate talk, right? I'll just quickly move on to the questions. Achla is asking, ma'am, is omega-3 fatty acid one of the essential vitamins during pregnancy? If yes, what are the sources and what should we do? I am in 24 weeks of pregnancy.
So for all my patients, I start omega 3 definitely. That is, like I said, DHA. It is found in capsules in medication like Fol 123, or you get omega 3 capsules also, or you may get something like Folvite DHA, which is available in the market off the counter, because again, you need about 200 micrograms of DHA every single day. So since you need that DHA, you can take it from there. Natural sources of DHA would be firstly walnuts. Walnuts and pecans are very, very good source of DHA. I recommend 2 whole walnuts or 4 halves to all of my patients every day. कई लोगों को लगता है कि they are garam, so then I say ठीक है भिगो के ले लो, but whichever way you take it, I need you to take that much of walnut every day. Other natural sources would be the seeds. So a bunch of mixed seeds. If you can take a spoonful of seeds. Again, with the seeds, there are some people in Indian culture, unfortunately or fortunately, everyone talks about garam khana and thanda khana and all. So in the first 3 months, people like to avoid that garam khana. So flax seeds थोड़े से garam होते हैं, but things like melon seeds, sunflower seeds, and chia seeds are very cooling. So probably 1 spoon of mixed seeds, which has everything, and a little bit of flax. You can start in your salad or in your yogurt right in the beginning of pregnancy and continue. But yes, at 24 weeks, please have an added source of DHA from one of the supplements which is available off the shelf. I hope that answers your question.
Absolutely. Thank you, ma'am. Next question is from Arpita. She says, what to do if iron tablet causes vomiting? She is 19 weeks pregnant.
I can understand that's a very, very common problem that most girls have, because iron can be really troublesome to your tummy. So, the good thing is that there are at least about 5,000 brands of iron, and sometimes when one doesn't suit you, the other might be able to suit you. So, that's the first option that you have. Of course, I must not underemphasize the need of getting good iron from your diet. So, you must take a lot of kala chana in your diet. Anar is very good, beetroot is very good, and if you take non-vegetarian, goat liver is very good. So you must take foods fortified with iron also. But at that same time, it does not mean that you can forego your iron tablet, because that much iron you need in your body, because there's going to be an extra circulation which you have to develop. Hemoglobin is also the oxygen carrying capacity of your blood. So a good hemoglobin will ensure that you don't get tired easily. So if one iron doesn't suit you, try to take another one. Take it about half an hour away from a meal, food, or calcium. So probably after a meal, try and take it, or half an hour before a meal. Some patients like to take it in the morning so that the whole day, during the day, they can digest it. There are also iron syrups available which you can ask your doctor to give. And now, fortunately, there are also some pyrophosphate iron formulations which are available, which can be taken with your food, milk, or calcium. So those create less acidity. So it's a different sort of iron which is available. So you can probably opt for one of those salts, or you can ask your doctor to talk about them to you. Unfortunately, if none of it works, then we'll have to give you iron on a drip form, which is a concentrated form of iron. Remember that when we give iron in the drip, that's also going to form hemoglobin in the same time. It's not a quick fix. It will also take a month to convert into hemoglobin, but yes, it will bypass your gastric system and it will be good for you. Another pro tip here, like I said, number one, take your iron away from food, milk, or calcium. And the second, try to take it with a bit of vitamin C. So if you take, say, it with an orange or a little bit of orange juice, it is definitely going to get absorbed better.
Thank you so much, ma'am. Ma'am, Lobina is asking, she's 16 weeks pregnant. So she says, I've been taking folic acid when we were trying to get pregnant. That is approximately 3 months before, and now I'm in my fourth month. And the doctor has advised to take them. Nothing else is prescribed till now. Is it normal for not prescribing anything? My blood reports are okay.
So the point is that because there's a new circulation happening in your body, after 3 months, it is recommended to take iron, calcium, and vitamin D along with the folic acid that you are having. So probably you can discuss it with your doctor when you go at this visit. Some gynecologists may be starting it a little later, but otherwise at 12 weeks of pregnancy, in fact, after the first 70 days of pregnancy are done, it is safe to take iron supplementation. I usually start, I think everyone has their own way of practice. I started as soon as 3 months are done, one iron tablet, two calcium tablets, and vitamin D if that was low, or at least a routine supplementation of vitamin D. So I think it's high time that you start that. Probably discuss it with your doctor in your next visit, because it is going to go low if you don't take those supplements. And we know that at 26 weeks, then you'll panic that your hemoglobin's gone really low.
Okay. Thank you so much, ma'am. I think that helps you, Lobina. Suman is 31 weeks pregnant, and she was COVID positive and has been in 21 days of isolation period. Now she's feeling much better than before, but since COVID set in, she has not been. She was asked to drop all her supplements. She wants to know if this affects baby's growth.
Okay, so supplements are for an ideal pregnancy. And what happens is that while you're taking supplements, there is enough in your body to give to the baby. Otherwise, it will be leached out from your body. So definitely, while you are having COVID, probably the supplements have stopped because you had enough medications to take at that time. You must be taking zinc, calcium, vitamin C, or azithrals and other medications which were recommended. And that's why probably the doctor felt that there were too many meds that you were taking. Remember that the period that you're taking these supplements is about 6 months, your iron, calcium, etc. 6 months, from 3 months till 9 months, and then 6 months after delivery. So it's a year. So if for 20 days you've not taken it, don't panic. ठीक है ना, start that right away. It is definitely required and required more. Also be very particular about your nutrition and probably add some more protein in your diet, because your body's been through a lot of trauma and a breakdown of your tissues, like in your lungs and other body parts, and that's why the CRP and all also rises. So see to it that you're taking a very nutritious diet now and go back to your supplements. You will make up, don't worry.
Thank you, ma'am. Ma'am, Jui is saying, even I feel so nauseated after taking these tablets. They are so big. So, are there any small tablets that they can take?
Yeah, not my place here to talk about brands as such, but yes, there are a lot of tiny iron tablets available. In fact, there are patients of mine who say that they can't take iron tablets, and I would give them a syrup. Similarly, there are clear calcium syrups available. So I think it's also a bit of a mental block. We say that itni sari goliyan, itni sari dawaiyan de di. So instead of looking it like that, talk about them as supplements. So when I start with my patient's pregnancy, I tell them that these are supplements. These are support for your pregnancy. Like if you need progesterone or something in the first trimester, and then these are the medications you usually need. That is for, say, a UTI or whatever other problem you're having. So the first thing in your mind is that stop calling them medicines. Call them supplements. They are going to supplement your body and they're going to help you have a healthier baby. So that positive feedback when you give that stuff, when you're taking all that stuff in your body, it's going to help you more. But yes, I can understand humanly also if there is a calcium which doesn't work for you, or a vitamin, or a calcium or an iron which doesn't work. Just identify which is the medication which is giving you trouble, and then speak to your doctor and ask her to change that supplement. But till the time you don't communicate with your doctor, and suddenly 3 months later someone tells me that मैंने तो कैल्शियम की गोली खाई नहीं कि वो बहुत बड़ी थी और मेरे को अच्छी नहीं लगती थी, it's really not helping you only, right? Because I'm assuming if you don't tell me there's a problem, it's working for you.
Absolutely, ma'am. I think communication is the key, rightly said. So, okay, here somebody is asking, ma'am, can we eat sabudana and banana as any source? Like, what will they get from these? And also, Meenal wants to know if soaked chia seeds can be eaten every day, like a spoon or two.
Yeah. So chia seeds are extremely good. They have a very good source of DHA and they're very cooling to the body. So chia seeds can be eaten throughout the pregnancy. Whether you soak it in water or milk or whatever, they're very, very good. The second thing that you asked me was?
Uh, do sabudana and banana
So
act as a source for any of the
yeah,
vitamins or
so banana has a lot of
supplements?
energy. It's a very carby fruit. It has a good source of energy, keeps your acidity down, has calcium in it. So yes, it's a good fruit, actually speaking. However, what I've realized it in my setup, there are a lot of women who are over 30 who are planning pregnancy, or all of Indian women have diabetes in the background. So again, the same thing, you're not planning a pregnancy if you're 18, 20, 22. So unless you do a lot of physical work, because bananas are a carbohydrate rich fruit also. It also helps you with your leg cramps and all. So if you're a leaner girl, right? Or if you have a problem with your appetite, then yes, one banana every day is an excellent fruit to have. But if you are already overweight, you have a history of diabetes in your family, or you're over 30, you know that diabetes will set in, or you have PCOS when you were planning a pregnancy, you know that sugary fruits and all are not good for you, then maybe an apple is a better idea. So all fruits are good, We say that have whatever is seasonal, locally available. Keep on changing the fruit that you're having so that you get nutrition from everything. So that if you're taking two fruits, maybe there's an apple every day and you take an orange twice a week, take a banana twice a week, take some guavas and whatever is seasonally available. That's a better idea because it gives you the nutrition from all the fruits rather than that old adage when women used to do all the household and physical work, and then they were very lean and they were very young. So they needed that much of nutrition and calories, where a banana was recommended to be had every single day. But yes, if you have cramps or calcium deficiency and you can burn off the banana, it is an excellent fruit to have.
Thank you, ma'am. Manasa has a question for you. Can we use paracetamol or generic medicine if we have fever of 100 degrees? If so, for how many days can we take? Like, is there
Yeah.
certain
So
restriction
let me
even when?
cover this. There are certain medications which are completely safe in pregnancy. So either the medications are safe or they're not safe. And remember that you're an adult, you're either 45 or 60 or 75 or 90 kgs or whatever your weight is. So you have to take the adult dosage. That is the first thing that you need to understand. So certain medications are completely safe. Paracetamol is one of them. Paracetamol means crocin, Calpol, Dolo. So whatever you normally used to take, be it a 500 milligram tablet or a 650 milligram tablet, that is completely safe for you. You can take it if you have fever, you have body ache, you have headache. That is the only painkiller or anti-inflammatory which is available for you in pregnancy, and it is extremely safe. So you can take it even 4 times a day. Remember that fever is more, especially now that COVID is there and there's so many people who are getting affected and getting fever. Have this clarity in your mind that fever is more dangerous than the crocin. Crocin is absolutely safe. Crocin or paracetamol, I mean. So please take the paracetamol. There is really no problem. There are also other medications like Eno, Hasmola, Gas-X. You can take it for acid gas if you're having that's bloating. If you have acidity, Digene or Zintac or even Pantocid, these are safe medication. If you have a cold, cetirizine is absolutely safe. You can take it during your pregnancy. You can take Nasoclear or any saline nasal drops. If you have a cough, something like a honey test is also completely safe. You can take these things. Honey test, remember that your sugar should not be high, of course. But otherwise, these are completely safe off the counter products which are available, which are safe in pregnancy, and you must take them on your own before your problem really worsens when we need to give you more medication.
Thank you, ma'am. Ma'am, Alankriti just wants you to let her know if this is okay or not. She's been prescribed folic acid 5 mg twice a day and one vitamin D capsule per week. Are these supplements enough for the first trimester?
So folic acid is, like I said, you need it only in micrograms. So unless you're carrying twins, one folic acid tablet is more than enough. It's a 5 mg tablet, needs to be taken only once a day. You don't need to take it twice a day. That's number one. Vitamin D is considered safe in pregnancy. There is no problem. I personally don't give it in the first trimester. I start from the second trimester. But if your doctor has given it to you at this time, you can take it from the second trimester.
Ma'am, I think your audio is muted. Okay, I think it's fine now.
Yeah, sorry. That's, I
Uh,
think, the disadvantage of a doctor's phone. You keep on getting phones on, and I'm actually doing this from the phone only.
Thank you, ma'am. Ma'am, so Deepthi is asking, are there any differences in the vitamin requirements between the 3 trimesters? What are the key requirements of vitamins in the third trimester and after delivery?
Yeah. So I have a sort of standard protocol in my head. In the first trimester, I like to give you folic acid. Second and third trimester, I will start with iron and calcium and vitamin D supplementation. And as soon as your vitamin D and iron and calcium start suiting your body and you're comfortable, definitely by 20 weeks at least, I will be starting your full white DHA or the DHA or the omega 3 in whichever form. The vitamin D, usually we give it to you weekly for 12 weeks and then go back to monthly. And once you deliver, after that, continue iron once, calcium twice, the full white DHA also daily till the time, at least for 6 months, preferably till the time you're breastfeeding. I also go back to vitamin D supplementation weekly for about 8 weeks and then continue back to once a month, which you should take for the rest of your life.
Mhm. Thank you, ma'am. Uh, 1 second. Okay. What is the best time to take vitamin B12? Currently, I'm taking it in the night.
And you can take vitamin B12 at any time of the day, as long as you remember to take it. So if you've associated it with and it works for you after dinner, it's perfectly fine.
Thank you. Udaya is asking, I'm currently in my 18th week and I'm taking folic acid, calcium, and iron. And I'm also taking 4 almonds, 2 pistas, one walnut, a handful of peanuts every day. Will this be enough? And can I take apple juice instead of apple, as apple is causing acidity?
I'm not a big fan of juice because when fruit is broken down, A, we lose the fiber, and secondly, the sugars are broken down and they actually cause a spike of blood sugar. So, probably, you can try just sort of grating the apple and using it in milk, like a smoothie or with yogurt, or just trying to change the time that you're eating the apple. ठीक है ना? So that itself will work for you. Otherwise, the supplements that you're taking, as far as the fruit and vitamins are, nuts and seeds are concerned, looks perfectly fine. At the same time, in pregnancy, it's if we are talking about the diet, I have a basic rule. It's say you don't need more than 2 chapatis in a day, one for lunch, one for dinner, 2 katoris of dal or paneer or non-vegetarian, 2 katoris of dahi, 2 glasses of milk, 2 fruits, 2 nuts, that's a badam and a akroot, and 2 proteins. So probably it could be 2 eggs in the morning, or eggs in the morning and paneer in the evening, or some good source of protein. So this is if you're taking this, and 2 katoris of vegetables in a day. So 2 katoris salad, 2 katori vegetables, 2 katori dal, 2 katori dahi, 2 glasses of milk, 2 nuts, 2 protein snacks, and 2 glasses of milk, I think we said, and 2 fruits. Yeah.
That's a nice formula, I think. We all can apply this. Okay. Ma'am, Preeti is asking, is there any extra added benefit of drinking saffron in milk or something? Like, should it be taken in 32 weeks in summer?
So a lot of people like to use kesar in their milk, like in our allopathic science, garam thanda, or these things helping you with labor, or some people believe that it helps you have a fairer baby. I really don't know whether they really work or not. But I think anything that you're doing which makes you feel happy, makes your family feel happy, and it's not going to harm you, there is no harm taking it. So after 32 weeks, if you're taking 2 or 3 dane of kesar in the milk when you sleep at night, like we tell otherwise people to take kachi haldi wala doodh because that's also nutritious and it builds up your immunity. If you're taking kesar wala doodh or even adding kesar to that haldi wala doodh, it's perfectly fine. There is no harm done. There's no contraindication. Yeah, it's not going to, I don't know how much it's going to help you in anything. At the end of the day, the people who deliver all over the world who don't have kesar in their doodh. But since it's not a bad thing and makes you and your family feel happy, please go ahead and do it.
Agreed. Ma'am, Achla is saying, all the seeds that you mentioned, I think pumpkin seeds, sunflower seeds, flax seeds. Achla is in Delhi and she's saying it's very hot here. So is it okay to have these seeds in summer or should they skip it?
Absolutely. So, see, the point is garam seeds are only the flax seeds. Chia seeds are cooling seeds, and melon and watermelon seeds and sunflower seeds are also perfectly fine. So what you do it is you can add it in your smoothie or your breakfast cereal bowl, or you can put it with your fruit for lunch, or you can put it in yogurt and have it. So that way you get the benefits out of these seeds also. It's a good idea to take 1 spoonful of seeds every day. In fact, I recommend it even to the husbands of the women when the women are trying to conceive, because seeds has been seen that flax seeds improves the motility of the sperm also, and the omega-3 is very good for the sperms, and that is why when you're planning pregnancy, seeds are recommended even for your partner.
Wow. Like we are getting to learn so many things from you today. Nikita is asking, can you please repeat when are we supposed to take DHA? I missed it.
Yeah, so I start, see, like I said, there's a DHA is a omega-3. It's a fat soluble thing. It gets retained in your body. So naturally, you start your seeds, nuts from the beginning of the pregnancy itself, right? By the time you get used to iron and calcium and all, it's about 20 weeks. From 20 weeks, I start adding the DHA in your medications or supplements. I will continue it till the time you're breastfeeding or at least 6 months after delivery.
As you mentioned, right, you gradually start different medications in different phases. So I think Fagun has this question. Is it okay to take no multivitamins at all in the first trimester? My doctor says no calcium, no vitamin D. Also, what is the reason for not taking these in early pregnancy?
Yeah, this is very interesting. So, what happens is that in the first trimester is the time for organogenesis. And the organs, the tissue, the bunch of cells is actually forming all the organs. So, we don't like to give you calcium or iron in the first trimester at all. Just folic acid is good. And if you're taking prenatal vitamins, which include some vitamin B12 or and B6 in it, it's perfectly fine. So just some water soluble vitamin, folic acid is fine. So B6, B12 and folic acid is adequate in the first trimester. Some people, like we discussed before this, that there's some doctors who give vitamin D. I don't start it in the first trimester. But yes, after the first trimester, your calcium and iron will be started. So these are but you can jolly well get it from your diet till then. So if you're not nauseatic and all, and you're getting good iron supplementation from your diet, taking good milk and milk products for the first trimester as it is, what happens, you don't get worried if you're not eating well or something in the first trimester. Because जैसे egg में yellow होता है ना, वैसे yolk sac होती है. So the yolk sac gives nutrition to the pregnancy till 3 months are complete. The baby is dependent on you on nutrition wise only after 3 months are done. So you can start all these supplements at 3 months. And just to be on the safer side, in the first trimester, we don't give you any extra supplements, but just folic acid, and we may give you B6 and B9 and B12, and that's it.
Thank you so much, ma'am. I think it makes so many things clear. Now, I think it is bothering her, so I'll take this question up. Shen Bagum is asking, I'm 7 weeks and 5 days pregnant from the last period day, and gestation in the scan shows 6 weeks and 5 days. But there is no heartbeat. How can I increase the heartbeat?
So, see, at 6 weeks, definitely we should see a heartbeat. So, I was okay with your pregnancy showing about a week less because you could have conceived little later. But whenever the sac size is about 6 weeks, there should be a heartbeat. So, unfortunately, at 6 weeks, 5 days, if we're not seeing a heartbeat, it doesn't seem that the pregnancy is going on well. However, since I'm not your treating physician, and say if your doctor has told you to wait a week with supplements and just hope that it comes in, sure. But normally a heartbeat should be seen in a good scan by 6 weeks itself. So 7 weeks, 5 days, I'm okay to believe that a pregnancy could look 6 weeks, 5 days. But at 6 weeks, 5 days also, we should have seen a heartbeat. And if it's not seen, probably you're going in for a miscarriage. I can't be sure because I don't have all your documentation. But I would have expected definitely to see a heartbeat. When you say, how can I get a heartbeat in a 6 weeks, 5 days? If none of us are God, I can't put a heartbeat in something which doesn't have a heartbeat. If it was an early pregnancy, say 5 weeks, 5 days, and that is when we are not seeing the heartbeat because the heartbeat appears only at 6 weeks. Doctors do give things like ecosprin, progesterone supplements, which I'm sure if your doctor's waiting, they've started those already and asked you to wait a week. But definitely, I would feel that at 6 weeks, 5 days, if you're getting a scan done by a good professional, you should have been able to see the heartbeat.
Thank you, ma'am. Ma'am, Sugandha has a question for you. Use ragi, jowar, bajra flour, and grounded flax seeds and mix it with wheat flour for making chapatis. Is it a safe way to consume this in this form? And I'm in
Absolutely.
my 35th week. Is it safe to consume beetroot daily? I take it with watermelon juice every day. I do not have any diabetes or high sugar problem.
Sure. So, whatever you're doing and adding good, nutritious food in your diet in whichever way which works for you, it's perfectly fine. So, whether you put beetroot in little bit of watermelon juice, or you make a beetroot juice, or you eat beetroot in your salad, or you take it as a vegetable, or you take it as a soup, it's perfectly fine. It's a good source of iron. So definitely it's going to help you on that. At the other end, that doesn't mean that it's going to do everything for your pregnancy. You need proteins, you need vitamins, you need other nutritious stuff also, calcium. So do everything in moderation. But yeah, if your sugars are fine and you're taking a little bit of juice and taking beetroot, it's a very good thing. So if you there are people who don't like beetroot, so they'll take kala chana in their diet. So whichever way you can supplement. So always think of what are the basic nutrients you need, and if not A, then what is the B that you can take to get them in your system. But you have to get them in your system.
Mhm. Thank you so much, ma'am. Ma'am, Nikita has a question for you here. I'll just take this up. Hi, ma'am. I'm 5 months pregnant, detected with hyperthyroidism. So, carbimazole, neomercazole, 10 mg, is it safe? I think her doctor would have prescribed.
Yeah. So one of the two will be given to her, whatever supplement has been given, because if she's hyperthyroid and her T3, T4 is also very high, it can harm the pregnancy. So she needs to get it corrected immediately. There are some which are medications in hyperthyroidism which are completely safe in pregnancy. If it's been recommended, it should be perfectly good.
Thank you, ma'am. Ma'am, so there is a question regarding hemoglobin levels, right? So Jyoti is saying, why does the hemoglobin get low in the last trimester? And then Spandana is asking how to improve hemoglobin.
Yeah. So exactly what I was saying, that if you're not taking iron supplements from 3 months, it's possible that your hemoglobin is really going to drop by the second or third trimester. So we are not checking hemoglobin every time, but I've realized that at 26 weeks odd, your hemoglobin is going to drop. Why is it going to drop? Because see, as a normal non-pregnant person, the circulation, you have about 5 liters of blood which is circulating in your body. By the time you are pregnant and there's a new circulation which is going to, there is 7 liters of blood which is circulating in your body. So water to aa jayega, but hemoglobin bhi to aana hai na usme. So even with iron supplementation, I have seen that if a girl is 12, she will be about 10.5 at about 26, 28 weeks. And that is when there is maximum hemodilution in the blood, or the blood seems maximum thin. After that, it starts getting better. And by, even if it's dropped to 10, it will pick up to 11 if you are continuing your iron supplements by the time you deliver. So it will pick up by the time you deliver. But after the second trimester, by 26, 28 weeks, it's probably at its lowest. So if it is less than 10 at that time, your doctor will obviously tell you to take more iron in your diet, more iron tablet if you can digest it, and if necessary, give you iron injections also, because if you're not able to take it, or your body is not absorbing the oral iron, or you're not taking it correctly, because I know of so many patients who will say, मैंने iron और calcium की गोली इकट्ठे ले ली. अनफॉर्चुनेटली वो आयरन और कैल्शियम दोनों टमी में ही एक दूसरे से चिपक गए, और ना आयरन अब्सॉर्ब हुआ ना कैल्शियम. अब आयरन तो आपको हीमोग्लोबिन में पता चल गया, बट यू डिडंट गेट टू नो अबाउट योर कैल्शियम एट ऑल. सो दैट इज व्हाई टेक योर मेडिकेशंस एंड सप्लीमेंट्स करेक्टली. And definitely, I feel ki hemoglobin, when you ask me the natural source, I am the biggest fan of Kala Chana. So Kala Chana, I feel, has the best source of iron, because it has iron and it has protein. It has heme and it has globin. So not only is going to build up your iron, it's going to build up your blood, which is the reason why we are looking for increasing the hemoglobin. And it's the cheap and the best source. So you don't need to go for expensive anars every day, or have an arka juice every day, and increase your sugars also. So if you take Kala Chana, so I say a very basic thing, एक काला चने का डोंगा कटोरी boil कर लो, it becomes like a donga, and keep the water separately. Keep that katori or that donga in the fridge, and every day in the morning, say before lunch, when it's easy to digest also, by about 12 or 1, put kheera, tomato and nibu in it, and have it like a salad every single day. So that katori will last three days. Make it twice a week. And the water you can have like a thanda soup only in the evening. Just drink it up and set up for that cup of tea in the evening. Your hemoglobin will increase so fast that it is the best source. Baki, of course, kala chana ke saath beetroot hai. Like I had discussed that anar is a good source. People will say apple mein hota hai iron, bananas mein hota hai, figs mein thoda iron hota hai. Then you have So all of these things you can increase, but beetroot and all also. But I think there's nothing, and of course goat liver, like I said, if you take non-vegetarian, but nothing as good as kala chana. I'm a big fan of kala chana. Kala chana ki cutlets bana ke sham ko kha lo. But take kala chana in your diet. It is the easiest way to have a good hemoglobin.
Wonderful. Fagun has a question for you. Can we take protein powders in the first trimester? If yes, which one is recommended and how much?
So, see, the point is that sometimes you have a lot of nausea in the first trimester and you can't eat properly. So, like I said, the baby is not dependent on you, but you feel tired and exhausted all the time, right? And you're not up to your best ability and it makes you feel depressed and feel low. In those cases, probably I would say that start a protein powder. Or if I feel that your diet is poor in protein, I would frankly say that since a baby is going to be dependent on you completely from 3 months, you try and keep your diet good in protein. Natural protein is a good idea, it's not a bad thing. So by natural protein, I mean that दूध ले लो, दही ले लो, लस्सी लो, पनीर लो. If you're vegetarian, dals हैं, all sorts of dals, rajma, chole, curry, gatte, all of them are very good protein. If you take non-vegetarian, 2 egg whites every single day. So these are good sources of protein. But yes, if we feel that there is a deficiency in your body to take that protein and you find taking a dabbe wala protein better for you, surely. But see to it that your protein doesn't have extra sugar. Because a lot of protein has a lot of fat and sugar also. And I wouldn't want you to take that unless, of course, you're having a lot of vomiting and you're not getting any nutrition at all. So yeah, there are a lot of supplements which are available in the market. There's Pro Hands Mom, there's Sim Mom, there is Mother's Horlicks. Whatever you take, whatever taste again works for you, because probably if you're taking it the first trimester, it's because there's a problem with your vomiting and taste and you don't like what you're taking. So whatever works for you is good enough. ऐसा नहीं है, so every doctor has some sort of brand on their pen or a couple of brands. And I think when you're, practice, I've been in practice for almost 29, 30 years now. And when you're in practice for so many years and you realize that there is no one thing formula which works for everyone. Everyone's pregnancy is individualized. But yeah, these ones which I've mentioned, they do have a good taste and usually acceptable by most girls. But try to pick up something which has less sugar and less fat in it.
Thank you, ma'am. Next question is by Chandni. She says, I'm in the 19th week of pregnancy and day by day she's feeling weakness and she's not feeling hungry. So is this expected at this gestational period?
I think 19 weeks is a beautiful time to be in pregnancy because your pregnancy is not small enough that you're scared of miscarriages like in the first 3 months. And it's not big enough to cause, sort of volume changes in your body like difficulty in walking or breathlessness, which happens by the time you're about 7 and 8 months pregnant. So 19 weeks, the pregnancy is not even really showing. So you don't need to be, that's one thing that you need to understand very clearly. अगर पहले आप एक रोटी खाते थे वैसे भी अभी दो नहीं खानी. You don't, when you say कि I'm not feeling hungry because घर वालों को लग रहा है सारा टाइम कि आप खाते रहो, it's not a great idea. You have to eat the same. Your calorie requirement has increased only by 300 calories, which is there in a glass of milk. So you have to eat healthier. You have to eat small and frequent meals. So you have to divide your diet. You don't have to multiply your diet. अगर आप एक टाइम पे बल्कि 2 रोटी खाती थी और दाल और से सब्जी खाते थे, से आप मटर पनीर खा लेते थे दोपहर को और 2 रोटी खाते थे. मैं कहूंगी कि आप 1 रोटी खाओ, साथ के अंदर एक दाल की कटोरी खाओ, एक सब्जी की कटोरी खाओ, एक सैलेड की कटोरी खाओ, एक दही की कटोरी खाओ. So that is the way you have to be working on your diet, eating healthier. You don't have to eat more at all. So that's a very, very important thing to remember, that when you say कि I'm not feeling hungry at all, is it your normal hunger that you're not having? Or is it that you feel कि नहीं मैं डबल नहीं खा पा रही? डबल तो खाना भी नहीं है. That's number one. And secondly, अगर वो भी खाना नहीं खा पा रहे, that means probably you're not digesting the food that you are having. That means that you're basically resting and you're not being active. So again, the same thing, that please become more active. Once you're active, you're walking, you're exercising, you'll be able to digest the food that you're having. It's a basic science. आप अगर खाना digest करोगे, तभी आपका stomach clear होगा, तभी आपको भूख लगेगी. So you have to be active. If you're not active, the your tummy is going to be full all the time. You will not eat more. You won't eat more. You'll still feel more weak. And that's no point. So try and push yourself to be active, whatever exercises or whatever you can do at this time, so that you can digest the food. Eat healthy. And your calorie requirement is not much in pregnancy, but whatever you eat, see to it that it has a good nutrition value.
Thank you so much, ma'am. Ma'am, you mentioned that it is okay to take saffron in milk. Meenakshi wants to know, is there like certain period of pregnancy after which they can start, or is it okay in all trimesters?
Like I said, these are all Indian mythology wale funde. But yeah, usually people ask me whether they can take saffron after 6 or 7 months. So it should be okay. Otherwise, also, if you're taking it earlier, there is no harm. People take, things like I'll tell you how it works. There are a lot of myths. India के अंदर जैसे हम लोग कहते हैं पपाया नहीं खाना, पाइनएप्पल नहीं खाना, दुनिया में बाकी कंट्रीज में लोग खाते हैं, पर हम कहते हैं चलो अवॉइड करो अगर आपके घर वालों को वहम है. Similarly, this garam cheese and all that people say. So there is no harm in taking all this if you're taking it even. I mean, it's not कि आपकी अगर थोड़ा सा केसर फर्स्ट ट्रिमेस्टर में भी चला गया तो कोई हार्म है, बट आई एम श्योर आफ्टर फर्स्ट ट्रिमेस्टर दिस गरम ठंडा बिजनेस गेट्स ओके. सो आफ्टर फर्स्ट ट्रिमेस्टर यू कैन टेक इट एनी टाइम. देयर इज नो प्रॉब्लम.
Thank you, ma'am. Ma'am, some COVID-related queries which I wanted to take up. Vandana is saying, I need clarification for the COVID vaccine. I want to take the vaccine looking at the current situation, but there is no clarification from the higher authorities. If it is suitable to take the vaccine, is there a brand which is suitable for pregnancy, or can they take any?
Okay. So let's be very, very clear. Even though the FOXY or the Federation of Obs and Gynae का position paper अभी 1-2 दिन पहले ही आया है that you will weigh the pros and cons and take the vaccine. Okay? There is no recommendation from ICMR that you can take the vaccine in pregnancy as of today. I'm sure it will be in the news the minute it can be given in pregnancy. So not the Covaxin, not the Covishield. They are not recommended currently in pregnancy or while you're breastfeeding. So you will not be taking either of the vaccine. Of course, if you're not pregnant and you're watching the show or there are other family members, whatever vaccine is available to you, please take it. And that is why if you're pregnant, see to it that the rest of the family is at least vaccinated. So also remember that the vaccine is not going to prevent completely you getting the disease. I've just recovered from COVID and I'd had both the vaccines. So, but your disease will be much milder, hopefully. And that is why it's important for the rest of the family to take the vaccine. Meanwhile, the most important thing is your masking, your staying at home, your social distancing, and hand hygiene. That can do what the vaccine cannot. The vaccine के बावजूद भी आपको कोविड होगा, पर अगर आप घर पे रहते हैं, आप डबल मास्किंग करते हैं, आप हैंड हाइजीन प्रैक्टिस करते हैं और आप सोशल डिस्टेंसिंग प्रैक्टिस करते हैं और आपकी फैमिली करती है, तो आपको कोविड नहीं होगा. सो द सिचुएशन इज वेरी क्लियर that please use these things, but the vaccine is not recommended currently in pregnancy or during breastfeeding.
Thank you, ma'am. Ma'am, here Harshita has another interesting question regarding COVID vaccine. She says, ma'am, I had taken the first vaccine for COVID before I discovered my pregnancy. Now, is it safe to take the second dose?
No, Harshita. Once you are pregnant, you cannot take the second vaccine as of today. I'm talking about the recommendations today because it's possible that in a week or something, there are new guidelines which come in. But as of now, the clarity is completely there. If you have got pregnant after taking the first vaccine, you cannot take the second dose. However, remember that you are better protected than someone who's not had even a single dose.
Thank you, ma'am. Ma'am, Amulya says, I've been tested COVID positive on last Wednesday. I took Dolo for 3 days. Currently, I'm not taking any medication. I'm gargling and taking steam regularly. I'm having a little bit of throat infection, a little cough. Do you suggest some medication to be added, or she can handle it with...
How many weeks is she?
She's 19 weeks.
Yeah. So for the cough, you can take honey test. You can take Tuscu lozenges twice a day. Of course, steam and gargling. And please take azithromycin. Azithromycin completely safe in pregnancy. You can take 500 mg once a day before your dinner for 5 days. And that will help you. Also, of course, keep on checking your oxygen. And if you got it last Wednesday, she said,
Yes, ma'am.
uh,
Yes.
yeah. So last Wednesday means today's Tuesday. Today's actually her. She's on completed her seventh day. Today's her seventh day, right? So you have to be very watchful between the seventh and the 12th day. So that is the phase where things can go wrong. Obviously, if there's no fever, you don't need to take Dolo. But take your vitamin C, take zinc, do your breathing exercises, take azithromycin, and doxycycline is not to be given in pregnancy, so be very clear on that. So take azithromycin and then just hopefully these 5 days you should get okay. Also, there are certain blood tests like your CRP, D dimers, which need to be done now. So please get your CBC, your D dimers and your CRP done. And if they are increasing, then connect with your doctor.
Thank you, ma'am. Suman is saying, is it a necessity to repeat RT-PCR again, as all the symptoms are gone and my growth scan is also pending? So should I get it done now, or is it okay to just let it be?
So the RT-PCR can remain positive even once you have got treated and COVID has gone away from your body, because it is an RNA detection test. And if there's RNA in your tissues, you will still get it. It does not mean that you're infected at this stage. So the recommendations for home isolation are that the home isolation will continue for at least 10 days or 3 days and 3 days of being asymptomatic. So if it has been more than 10 days since you showed your first symptom, and the last 3 days you've been completely without fever or any other symptom, then you can move out without getting the RT-PCR done. You will use mask and stay in your house. But once about 17 days are done and you've not been symptomatic for a week, you can move out and get your ultrasound done. There is no rush for it. It can be done then.
Thank you, ma'am. Ma'am, Shruti has a question for you. She says, I have severe dry back acne issue. Can it be because of an allergy to any of the medication, or is there any other underlying issue?
Yeah, so back acne or acne in your body, hormonal issues come up in pregnancy only. So it could be just the pregnancy hormones which are acting up in your body. And that is why I don't think it would be because of iron or calcium or any allergy to those. So they are probably because of the hormonal changes in your body happening because of the pregnancy.
Thank you, ma'am. Ma'am, Neha and some others want to know what should be the normal range of body weight in different trimesters.
So there is no range of body weight actually. See, how it works is that obviously if you start your pregnancy on a healthy weight, it's a great idea, right? And what we normally say that don't gain more than 1 to 2 kilos every month, starting with 3 months. Because 3 months, I told you, the pregnancy is not even dependent on you. So there are a lot of people who have a lot of nausea and may even lose weight in the first 3 months. After that, gaining about 1 to 2 kg every month is perfectly fine. And so in pregnancy, you end up gaining about 10 to 12 kgs of weight. This I'm talking about a person who's an average weight, say about 56 to 65 kilos. If you're starting at 45 kilos, I would obviously want that you gain better weight. And so probably 2 kgs in a month is what we're looking at. At the same time, if you started your pregnancy at a weight of 75 kg or 78 kg or 85 kg, then I won't want you to gain that much weight. I would say that, okay, even if you're gaining half to 1 kg, it's okay. So eat healthy, eat nutritious, and let your doctor bother about the weight. But definitely don't gain 25 kilos in pregnancy, even if you are a 45 kg, a 60 kg, or a 75 kg person.
Thank you, ma'am. Ma'am, Nilima has a question. She says, can I skip my 32 to 34 weeks ka growth scan as per the current situation?
So it's not about skipping the scans, but yeah, I can understand it's a very tough time out there. And if everything's been going perfectly fine, your baby movements are perfectly fine, the doctor felt that your last scan, depends if your scan was done at say 28, 30 weeks, then there's nothing to worry about. But say if the last scan was done at 20 weeks and after that till now there's no scan been done, but your doctor's been checking and the baby is growing well, and that the movements are very good. Your weight gain is absolutely normal. You feel perfectly fine and healthy. Yeah, you might have to do. These are very unprecedented times. There's no protocol as such. See, as a doctor, it's my job to tell you what is ideal for you, and you need to work on what you can do. So you have to be practical. Obviously, if someone gets COVID between 32 to 34 weeks, she's not going to come for her scan, right? And similarly, the situation is so bad, and if you feel that you're going to get COVID from some place, then you're not going to go, right? But if that scan is required, again, the same thing, then you do move out of the house if it is required. You will wear a double mask. You will take care to go in a place which is not so crowded, right? And you can probably go in the beginning of the day or something and get your scan done. You're not going to get your scan. You're not going to get COVID if you're wearing an N95 mask and you're careful about your hand hygiene. You'll be surprised to know most of us also, even as healthcare workers, if you're not working in COVID wards and if you don't go to a place where COVID patients hain, you're not going to get COVID from there because you're going to take care. You're going to be wearing a mask. You're going to use hand hygiene. The point is that most people get COVID from a place where they are not taking precautions. So maybe it will be from house help in the kitchen or your husband's factory when he's working and talking to workers thinking they're normal, or from these parties that people have and socializing. When you eat and drink together, that's when you take your mask off. That's from where you're going to get COVID. Your healthcare provider से वहां से आपको कम chances हैं. But I agree, don't go to a place where there are COVID patients, and only if required you go. So if the doctor feels that yes, you must get it done because there's something they're worried about, say you're diabetic, you're hypertensive, and it might affect the growth of the baby, it's important to get the scan done. It's like that. Otherwise, postpone it for a week. Hopefully, things should be better within a week or two.
Thank you, ma'am. Ma'am, Gaurav has a complaint here. He says, my wife doesn't drink water adequately as she has the urge to urinate again and again. Please suggest what can be done.
So I'm very happy that Gaurav is listening to this show. It just, yeah. So one pat on the back for Gaurav because he's being a dedicated husband and who's listening to us and he who is concerned for his wife. And that's the first thing his wife needs to understand. She should be proud of the fact that she has a husband who's concerned about her. So he's not pushing her, but he's concerned about her. Of water is going to help you. So at least 8 to 10 glasses of water to lena hi hai. Probably uh, having frequent urination is otherwise also a sign of pregnancy, and because the bladder may be getting irritable with the increased uterine size. But at the same time, please do watch out. Sometimes there might be a urine infection also. So I would suggest that if the urinary frequency is too much, Gaurav, you must get a urine routine and culture done. And definitely having 8 to 10 glasses of water, nariyal pani, lassi, chach, nibu pani, whatever works for you. But keep your fluid intake good. Definitely.
Thank you, ma'am. You've been patiently answering questions. I'll just take a couple of them and then we'll close it off.
Sure.
I'll take, okay. Yeah, somebody's asking, can I take calcium and multivitamin together? If
Yes, you
not,
can.
how much time? Okay, they can
You can
take them
take them
together.
together. There's just the iron you take separately.
Okay, so ma'am, you mentioned that, egg is good, a source of protein, right? So only egg white, or can they eat it with egg yolk, or what is the protocol they are
So,
supposed
egg
to
is actually one of the best sources of protein. I don't know why my voice is echoing. Is it all right?
Yes, it's okay, ma'am.
Yeah. So, egg is definitely one of the best sources of protein, and the egg white has 100% protein in it. So, it is one of the best sources. Normally, I tell my patients to have 2 egg whites and 1 egg yellow every day. So, 1 egg yellow has good fats only. It's not, unless, we are not talking about restricted cases like your cholesterol is really high or something, but normally 2 egg whites, 1 egg yellow is perfect.
Okay, ma'am, one question here. Fagun says, my doctor says no to yoga and exercise in the first trimester at all. And before pregnancy, I've been a workout pro person and have been into gymnastics also. What is the reason of only going for walks in the first trimester? Also, my doctor recommended me to have Sustain 300 mg at bedtime and also EcoSprint 75 mg at breakfast. What are the need of these medicines? And if pregnancy is completely normal, why am I taking these? I am 5 weeks pregnant, and there is also proper heartbeat of my baby.
At 5 weeks, there's a heartbeat. Wow. Okay. So the first thing is that even if you have been a very sporty and active person, what happens is that in the first trimester, there are increased chances of miscarriage. So most 20% of pregnancies will not carry forward and 80% will. And if there's a blood clot or something inside, there is no way of us getting to know also, because later in pregnancy, what happens is that the baby's movements tell us that the pregnancy is fine, and other things tell us that the pregnancy is fine. So we don't want you to overexert in the first 3 months, and probably get your you don't do intensive yoga and all, but you can be active, as in household work jo aap karte ho wo aap karo hi karo. If you walk, you can walk even for an hour, there's no problem, and you can do a good brisk walk. So don't you can do stretches, you can do breathing exercises. So all of these things are good. By the time 3 months are done, your placenta forms. Once the placenta forms, if it's not low, then we say, yeah, now you can start any prenatal yoga or exercises, but be careful on that. But if your placenta's low, then we would continue restricting those. So we don't want any harm to come out of the pregnancy. The second thing, you said that everything is normal, and yet you've been put on Sustain or EcoSprint. I'm sure normally it is not required. There might be some factor, like someone has a previous miscarriage, or you had pain in the abdomen, or your age is more than 30, or the doctor felt that you've conceived with treatment and she wants to give you some support in pregnancy. So I think the best person to tell you that why you needed these support would be your doctor. But I'm sure that that trust has to be there with you and your doctor, and that open forum has to be there where you can discuss with your doctor that what is the reason, and you can talk to them. I'm sure she has a logical reason which may have not been evident to you, because your pregnancies, I agree, sounding perfectly fine. But yes, if you had PCOS earlier, or she felt that there's a risk that you can miscarry, or you had a previous miscarriage, age, advanced age, or any other high risk factor, it's possible precautionarily she's added some progesterone. But please go and, you can go ahead and discuss with your doctor why that has been put for you.
Thank you, ma'am. Okay, ma'am, last question for the day. Jaya is asking, how can we control protein traces and blood in urine? Please suggest. I'm 13 weeks pregnant.
Yeah, sorry, I think we just broke off. Yeah.
Okay. Ma'am, Jaya, I think I'll just ask the last question. Jaya is asking, how can we control protein traces and blood in urine? Please suggest. I'm 13 weeks pregnant.
So protein traces and blood in the urine should normally not be present, right? Is some stones or something that you have. So probably your doctor will get a urine culture done. It is possible that they give you some antibiotics, increase the water. But even then, if there's blood in the urine or protein in your urine at this stage is not normal, and that is why it will need to be investigated, that could it be or cheese study. If it doesn't get okay on a repeat sample, so it's possible that on a repeat sample it gets okay if you have more water, have a urinary alkalizer, rule out infection, and it should get okay. Otherwise, it's possible to get your kidney function and all also done, because protein traces is something we should see as a routine, and
Ma'am, I think there has been some network issue, but Jaya would have got her answer. Thank you so much, ma'am, for doing this session with us. The users are really, really thankful. Like, they are constantly writing. They learned so much from this session. and they really want you back again. So I'll keep in touch with you for the next session. And to all the users whose
Absolutely.
those questions I did not take up, that would have been because ma'am has answered that question already. So we would want you to go on YouTube and check ma'am's session after this and listen to everything she has to say about your queries. And if it is not related to the topic, we tried to take as many questions as we could. But if we missed out your questions, please post it in the feed section and one of our experts will revert within 24 hours. Um, Till then, please stay safe, take care of yourself, and we will be back soon with another informative session for you. Thank you so much, ma'am, for doing this session.
Thank you for having me here, and it's been a pleasure. And I would be only too happy to be back here again. Thank you.
Thank you. Bye.